Okay, so when we were looking into what really runs a peer-to-peer support and how that can drive not only outcomes, but during the process of having a disability, having a complex medical need, having cancer, having heart disease, why is peer-to-peer support so important? And what can it do to the outcomes? So we all know, I'll tell you a little bit of a story. When I was 38 years old, my third child was born. I was a very experienced mom. I'd been a mom for 18 years. My son was born with a congenital heart defect. I didn't know it at the time, and I was in the hospital, and they gave me this baby, and they started using all these long words with things that I had no idea what they were talking about, and they sent me home with some medications that I had no idea needed a compounding pharmacy. I didn't even know what that was. So I took these prescriptions down to my local pharmacist, and I was like, here you go. I need to get these for my 3-day-old baby. And they're like, well, we don't fill these here. You have to go to a compounding pharmacy. And I'm like, well, what's that? So the process entails that I have no idea what's going on. I got no support in the hospital, mostly because I feel that I looked educated. I kind of carried myself and like, oh, okay, I've got this. It's okay. It's not a problem. So I didn't ask for help because I really did think I had taken, all of the precautions that I needed to take. I had my prescription in hand and I was going to the pharmacy. So once I got there, the pharmacist kind of gave me no information either. So I went home and I had to start Googling and I asked friends, and so I finally figured out what a compounding pharmacy was and I got the medication. But how much easier would it have been if I'd have been in the hospital and I had somebody come up to me and say, you're getting ready to take this baby home who's kind of critically ill at this point and needs these medications. This is what a compounding pharmacy is. This is where you find it. These are the ones we have in town. Do you need any help? So focusing on what an empowered patient or an empowered caregiver, if that's what they are, what that does to outcomes is really vital, I think, in the healthcare topic. Because if you know what you're doing and you understand, and it's not just an education level, but really, truly understanding what you're going through and how to navigate that system, I think that you become stronger, you become more able. Empowered patients focus on recovery and treatment options versus I'm going through something really bad right now. I also, at the time that my son was born, until he was 11 weeks old when he had his open heart surgery, I wouldn't plan a family outing or a family vacation post-surgery because I couldn't look that far ahead. I didn't think we were going to make it that far. And so once I got that support from Mended Hearts and Mended Little Hearts, the support became a lifeline. Oh, look, these people have made it. They're there. I might be able to be there too. And so community support really does improve outcomes. A CMS finding in 2014 from Mended Hearts hospitals that have a program with peer support are significantly more likely to be better than U.S. National rate when it comes to readmissions. So we can lower readmissions, which obviously helps hospitals. But what does that mean to the patient? That means that they're adhering to their treatment, they're taking better care of themselves, they're doing the things that they need to do so that they're not being readmitted to the hospital. And so reducing readmissions is obviously important for the hospital, but it's an inexpensive solution with peer-to-peer support to lower these healthcare costs. If you take your medication as you're supposed to, you're reducing your risk of relapse, you're reducing your risk of a second heart attack, you're reducing your risk of seizures, things that you can do personally by just adhering to your medication to reduce the hospital cost, your readmission, and your life issues. So in-person, these are the different types of supports that can be offered. You've got in-person and on-demand. You can be in the hospital. There's all kinds of ways that you can reach individuals. And when you're reaching an individual, you need to understand that each person is going to be in a different area at a different time. And who better to understand that point and understand that process than a person who's already been there? And so if you train these peer supporters, and we go into the hospital, we go into a local coffee shop, or you have people that come together online, and they can talk about real world experiences and say, you know, not just a guideline of you should take your medication at this time, but how it can actually work in real life. You know, I know I'm supposed to go to the gym and work and eat healthy, but real world says that I have 30 minutes from the time I get off of work until my daughter has dance and my son has soccer. How am I supposed to make a healthy meal in 30 minutes for 5 people plus get across town? Well, Wendy's is looking pretty good in the option of grabbing it and eating it in the car so we can get to where we need to be. So if I've got somebody who says, you know, I feel you, this is what I've done. I've, you know, pre-made this meal, I do it on Sundays. Now I actually do make meals on Sundays for our entire week, and I pull it out of the fridge during the day, and it's made for me. But that didn't come from a doctor to tell me how to eat. That came from a friend. And so I think that this peer support is really vital to giving you real world examples on how to do it. How do you remember to take your medication? Part of it is a power of habit, right? It's a social support system. And you talk about how to remember to take your medicine every day. You role model, you show people results with other people, friends, peers. Also, a big part of that is connecting to resources. If all of these wonderful resources out there, like the PAN Foundation and a couple of the ones that you had just mentioned, how do people find these resources? The doctors aren't spending time in the offices. They don't have the time. They need to get in and out. Social workers, they have a huge caseload, right? I mean, they're going to identify the most need, and they're going to go to those people. And so peer support organizations can say, you know, we can hook you up with these resources. This is where you go to find this. This is where you go to the compounding pharmacy, for example. And then we also have the emotional health, which, you know, you have isolation, you have depression, you have fear of the unknown, all of these things that you can work through. Nobody wanted to hear me talk. My husband would tell me, just stop talking about it. And I'm like, but I don't know why you can stop talking about it, because that's all I can do is talk about it. And so you deal with that differently. And, you know, if I'd had somebody at that point that would just let me listen, or just listen to me talk about this unknown that I couldn't do anything about, my husband probably would have kept his sanity, because I wouldn't have had to talk to him about it. But so we can improve outcomes by providing that peer-to-peer support, the emotional support, the comfort and the need that we can give only because we know how you feel, we've been there. And I think that that is where the improved outcome comes from. So Marcia is going to talk about the 2 different case studies that we did in the 2 different areas of the country really quick.